Hi, let me introduce myself. My name is SALMANITA ZAHARA, and my student number is 3112135. I'm from class A and part of Pharmacy Department BTH University. Here I want to explain about prescription and over-the-counter, or we can call it OTC drugs. Before it, I want to explain the definition of drug. A drug is a substance intended for use in the diagnosis, cure, mitigation, treatment, or prevention of disease. A drug is a chemical that interacts with protein in the body to affect a physiological function. This is the general idea behind all medicine. Once these chemicals are absorbed into the systemic circulation, they bind with certain proteins and this changes the functioning of the cell slightly. For example, anti-cancer drugs bind to proteins on the surface of cancer cells. This stimulates the cells to die. In this case, cell death is the physiological action of the drug. But here, I want to explain more prescription and OTC drugs. A prescription drug is a pharmaceutical drug that legally requires a medical prescription to be dispensed. In contrast, over-the-counter drugs can be obtained without a prescription, and the example of prescription drugs are: first, atorvastatin; second, levothyroxine; the third, lisinopril; fourth, metformin; fifth, amlodipine; sixth, metoprolol; and for the last is albuterol. And over-the-counter or OTC medicines are drugs you can buy without a prescription. Some OTC medicines relieve, assess pains and itches. Some prevent or cure disease like tooth decay and athlete's foot. Others help manage recurring problems like migraines and allergies. In the United States, the Food and Drug Administration decides whether a medicine is safe and effective enough to sell over the counter. This allows you to take more active role in your healthcare, but you also need to be careful to avoid mistakes. Make sure to follow the instruction on the drug label. If you don't understand the instructions, ask your pharmacist or healthcare provider. Also keep in mind that there are still risks to taking OTC medicines. First, the medicine you are taking could interact with other medicines, supplements, foods, or drinks. And second, some medicines are not right for people with certain medical conditions. For example, people with high blood pressure and should not take certain decongestants. And for the third, some people are allergic to certain medicines. And for the fourth, many medicines are not safe during pregnancy. If you are pregnant, check with your healthcare provider before taking any medicine. And for the fifth, be careful when giving medicines to children. Make sure that you give your child the correct dose. If you are giving your child a liquid medicine, don't use a kitchen spoon. Instead, use a measuring spoon or dosing cup marked in teaspoons. An example of over-the-counter drugs are: first, Actifed; and for the second, Icadril; for the third, Tuceran; for the fourth, Sanaflu; for the fifth, Combatrin; for the sixth, Cerebrofit; for the seventh, Conidine; for the eighth, Paramex; and the last, Betadine. And for the last, I want to take a summary that differences between OTC drugs and prescription drugs. Prescription drugs are: first, prescribed by a doctor, and second, bought at a pharmacy, prescribed for and intended to be used one person; fourth, regulated by FDA through the new drug application process. And OTC drugs are drugs that do not require a doctor's prescription. Second, bought off the shelf in the stores. Third, regulated by FDA through OTC drug monographs.